Welcome to Peds Doc Talk TV. I am Dr. Mona Amin, a board-certified pediatrician and mom, and today we're talking all about stomach viruses. What are the symptoms? What do you do about it at home? And when to seek medical attention? This video is brought to you by the New Mom Survival Guide, an online digital e-course created by me to educate, empower you, and provide a community as you navigate that first year of motherhood. For more information, click the link in the caption. Before we continue, make sure you hit that subscribe button because that's how you stay up to date on all of the videos I will put out here on Peds Doc Talk TV. And here we go. Common reasons for vomiting and diarrhea include a stomach virus, stomach bug, or viral gastroenteritis. These are all synonymous terms. You can also have vomiting and diarrhea from a bacterial infection. This would be something like Shigella or Salmonella. Food poisoning can also cause vomiting and diarrhea, and in rare instances, parasites. These are the infectious reasons of vomiting and diarrhea, and of course there are other reasons that a child can have this as well, but I'll go over more red flags that would warrant an evaluation if your child is having stomach symptoms such as vomiting or diarrhea. A stomach bug is called viral gastroenteritis, and this basically means that there's inflammation in the stomach or the intestines. Symptoms can be vomiting, diarrhea, or both. Symptoms can be short-lived or they can linger, with your child saying that they feel nauseous for even days or a week or more after the symptoms improve. Common viruses that can cause viral gastroenteritis include enterovirus, rotavirus, norovirus, and adenovirus. When it's a virus, it doesn't really matter which virus is causing the symptoms because the management is the same, which is something called supportive care. Because it's a virus, there's no treatment. For example, COVID-19, which is caused by the SARS-CoV-2 virus, can cause stomach upset in some children, which can include vomiting and diarrhea. So it's important that if your child is having vomiting and diarrhea symptoms, that you speak to your child's pediatrician to determine if COVID-19 testing is needed. Food poisoning is actually different than a stomach bug or a stomach virus. Food poisoning is actually caused by a bacteria, commonly Staph aureus, and parents will often come in when their child has a viral symptom of a stomach bug, and they'll say, oh, my child must have ate something bad. Now, in the end, the management is the same, but a stomach bug and food poisoning is very different to me in terms of how it presents. Food poisoning is usually caused by foods that are left out for too long. These are foods such as pasta salads, things with mayonnaise in it, things that have avocado in it. If that is left out for too long, that can cause this bacteria to overgrow, releasing the toxin that can cause food poisoning. The symptoms of food poisoning usually go as such. You enjoy the meal, you don't even realize that it tastes funny, and then 4 to 6 hours later, you're having vomiting and or diarrhea. After you expel that toxin from your body, you actually feel better. You feel like you're ready to eat again. You don't have that typical lingering nausea that can happen with a stomach virus or a stomach bug. That is the differentiation. Now, it's true that some stomach viruses can be just a 24-hour thing, but usually a stomach virus has that lingering nausea, I don't really feel like eating. Those are the common things that I hear. Versus food poisoning, once you get that food out of your system, you're feeling ready to eat again. And like I said, even though they are caused by different mechanisms, one is a toxin from a bacteria and the other is a virus, the management is essentially the same. Viral gastroenteritis is inflammation in the lining of the stomach or intestines. Gastroenteritis as a term can be caused by viruses, but it can also be caused by bacteria. In children, 90% of the time, we do see it caused by a virus. Symptoms include vomiting, diarrhea, irritability, nausea, abdominal cramping, low-grade fever, headaches. In a child who is non-speaking yet, they may be very fussy. Symptoms can occur together where you see the vomiting and diarrhea occur on the same day at the same time, or you can see one alone or one happen before the other. In bacterial gastroenteritis, we want to monitor for a couple things. If diarrhea is persisting beyond 2 weeks, your clinician may want to check a stool study to make sure it's not an ova, a parasite, or a bacteria causing the symptoms. Another big thing we want to know is if the diarrhea is associated with fever, especially with blood in the poop. If there is blood in the poop, we would want to know right away so we can determine if this is something that needs an evaluation, such as a stool sample. Common bacteria that can cause bacterial gastroenteritis can include Shigella, Salmonella, Yersinia, Campylobacter, and E. coli. Depending on the age and clinical presentation of your child, if they have bacterial gastroenteritis, they may or may not need antibiotics. In an older child who is clinically well, sometimes we don't need to prescribe these medicines. So it really is based on a case-by-case basis. So are these things contagious? Well, food poisoning is caused by a food that the person eats and develops the symptoms. So that won't be contagious if you accidentally touch the vomit or poop of someone that you're helping out. But viral gastroenteritis is very contagious. That means the secretions that we release from our body, whether it's mucus, whether it's poop, whether it's vomit, is contagious. So it's really important to remember that yes, a viral gastroenteritis picture can be very contagious. So we want to take as many precautions in the home to prevent the spread. The best thing we can do is wash our hands after taking care of someone who may have these symptoms, or if we have these symptoms as well. Disinfecting surfaces with bleach-based products can also help. I typically don't need a family to use bleach-based products on an everyday situation, but stomach viruses are extremely contagious. So if there is someone in the family who has it, it may be beneficial to use these items on shared surfaces. If your child has symptoms of a viral gastroenteritis, we would want to keep them home for 24 hours, fever and medicine free. This means things like no Tylenol or no Motrin. We want to make sure that they are okay without a fever before we send them back into school or daycare. In terms of diarrhea, the daycare or school would want a few things. If it's a potty trained child, we want them to not be having any accidents. If it is a non-potty trained child, we want to make sure that they're not having accidents that overflow outside of their diaper. And of course, we want them to be hydrated and clinically better. So if you're feeling like they're better and you feel comfortable sending them and they are fever-free for 24 hours and not having any accidents, they can go back to school. One of the biggest things to remember is that it is really hard taking care of a sick child, especially when they're vomiting and having diarrhea. When you start to see your child retching, making that sound that they're about to vomit, it can actually induce vomit in you. So I want you to know that you're not alone if you get that gag feeling, if you're feeling nauseous while you're having to clean it up. The virus will get better, their illness will get better, and if they don't, you're going to seek medical attention, and we'll go over that. The key to managing a stomach virus is focusing on hydration. I can't tell you how many times I have parents in my office whose child has vomiting and diarrhea, and the parent is so upset that the child's not eating. And I want to remind you that even for us, if you are having vomiting and diarrhea, but especially vomiting, you are not going to want to eat a big meal. When we're sick also, food is not a priority, but liquids are. We can go many days without food, but we cannot go hours and days without hydration. It is really important to focus on hydration. You're going to still offer the food, but you have to remember that they may not want it. And I'm going to go over some tips on how you can introduce hydration and meals if you need to. With liquids, focus on the preferred liquid. So if it's an infant, you're going to focus on breast milk or formula. If they're not taking their preferred liquid, then you'll speak to your child's pediatrician if your child is under 1 year old to determine if they need something like Pedialyte. If your child is under 1 and not taking their preferred liquid, I want you to speak to your child's clinician because I want to make sure that we assess their hydration before deciding if something like Pedialyte is necessary. If your child is over 1, you also continue to do their preferred liquid. Ideally, this will be water, breast milk if they're still breastfeeding, diluted Gatorade, or Pedialyte. But remember, the diluted Gatorade and Pedialyte is if they're not taking water and if they're not taking breast milk if they're still breastfeeding. One of the biggest mistakes I see is that after a child vomits, we immediately want to give them liquids right away. But think about the last time you've had vomiting. Your body is still nauseous. We want to wait a little bit before we offer liquids. So you can use something called the 20-20 rule. Wait 20 minutes before you offer anything. So if your child vomits at noon, wait until 12:20 before you offer 20 mLs of their preferred liquid. You can even start a little bit lower if you want. If they tolerate that, you can give a little bit more the next time in about another 10 to 20 minutes. So 20 mLs, wait a little bit, 20 mLs, but start slow. If we immediately give them liquids right after they vomit, or if we allow them to guzzle down liquids right away, we're gonna see that vomit come back up. We want their body to settle a little bit, and by using that 20-20 rule, you're gonna assure that you're getting hydration into them in these small amounts, but you're building up as they tolerate the liquids. The goal is small, frequent feedings, and you can use a medicine cup to measure this out, or you can use a syringe, whatever works for you. And if you want to start with a smaller volume than 20 mLs, that is perfectly fine. If it's an infant, you can take them to the breast or offer formula from a bottle, but start with a lower volume than they are normally getting, and make sure you wait at least 20 minutes after a vomit episode. If your child is hungry, start slow. Of course, I want them to eat if they're hungry, but sometimes their eyes don't really understand that they're still nauseous, so they'll eat and eat and eat, but it'll all come back at us. So we want to also use that same rule with hydration. If they're hungry, you can start 20-30 minutes after a vomiting episode with some food. My advice is to start with hydration first to make sure that they tolerate that. If they are saying that they're hungry, start with a small amount of food. You don't need to make it completely bland, but I want to make sure that it does not have anything spicy, acidic, or fried, because those things can be a little bit aggravating to a child with a stomach virus. So any other food is okay. Bland is better because we don't want too much flavor or spice when their stomach is healing, but offer a small amount. If they do well, you can add a little bit more later. So your schedule may be a little bit off when they're having a stomach bug. Maybe you normally have 3 meals and 2 snacks, but when they're having a stomach bug, you're gonna have a little bit of leeway here. Offer what they need, start slow and smaller volume, and build up as tolerated. If your child is having diarrhea, I would monitor giving them dairy or sugary drinks. Sometimes these liquids can cause a secondary intolerance to these items. What happens when we get a viral gastroenteritis is the virus can strip our intestinal and stomach lining of all of those good bacteria temporarily that help break down dairy and sugary drinks. So if you're giving your child dairy or sugary drinks and they have diarrhea and you feel like the diarrhea is persisting, I would try to switch to something like water, Pedialyte, diluted Gatorade that has less sugar, because we don't want to exacerbate the diarrhea symptoms. If your child is in pain, it's okay to medicate them with Motrin or Tylenol, which is ibuprofen or acetaminophen. If your child is under 1 year of age and is in a lot of pain, it's best for us to have you seek medical attention. I personally recommend acetaminophen over ibuprofen if a child is not eating, because sometimes ibuprofen can cause irritation to the stomach lining. Although you are managing this at home, it is really important to know when to seek medical attention. And the biggest thing is dehydration. Some signs of dehydration include decreased urine output, which means less diapers, or if your child is potty trained, less time going to the toilet, dry tongue and mucous membranes, dry eyes and no tears, sunken soft spot in babies, slow capillary refill, which is when you press the tip of your child's finger and it takes a long time, more than 2 seconds, for the color to return. So if that happens, they may show a sign of dehydration. If any of these things are happening with reduced oral intake of liquids, it's important to seek medical attention. Another very important sign that we need to see your child for is if your child is having severe abdominal pain. Of course, I mentioned that stomach viruses can cause vomiting and or diarrhea, but if a child is in a lot of discomfort where they're doubled over in pain, the vomiting and diarrhea does not alleviate any of that pain and that pain persists. Your child needs to be evaluated to make sure we do not need any imaging or further evaluation. Other signs that your child needs to be evaluated: your child is younger than 2 months of age, there is blood in the vomit or dark green vomit, there is blood in the stool that's persistent, meaning more than one episode, yellowing of the eyes or skin, which can be a sign of jaundice or an obstruction in the biliary tract, or your child has an underlying medical condition where vomiting would be a concern. The mainstay in management of a stomach virus is hydration. So follow the tips that I already mentioned. But if your child is not keeping liquids down or is so nauseous where the sight of a liquid, even using that 20-minute rule, is making them vomit more, it's important to seek medical attention. If that is happening, your child's clinician or the ER may recommend a medicine called Zofran or ondansetron. This is a medicine that's an anti-nausea or an anti-emetic medicine. Depending on the age of the child, this medicine can be administered in different ways. It's available in liquid form that they swallow. It can be administered as a pill that the child puts underneath their tongue or a pill that is swallowed. It can be given every 6 hours, and I think it's useful if a child is not able to keep liquids down. I usually don't really recommend this medicine if the child is able to keep liquids down because that is the goal. But it is okay to take it if your child is super uncomfortable with the nausea. I just feel like less meds are better, but if a child really needs it because they are not drinking or the sight of liquids make them nauseous, it's important to consider taking this medicine to keep them hydrated. If your child is dehydrated and you seek medical attention, your child's clinician or the ER will evaluate if your child needs Zofran, and they'll do something called a PO challenge. A PO challenge is something where we offer liquids in a clinical setting to see if they can handle it. If your child is extremely dehydrated or not taking the PO challenge, then they may need IV fluids. IV fluids will help replenish the fluids lost from diarrhea and vomiting. In some cases, children will get this in the ER and be able to go home. In other situations, the child may need to be admitted into the hospital for further observation to make sure their hydration status is okay. To prevent stomach viruses, the best thing we can do is wash our hands. If your child has vomiting and is in school or childcare, it's important to keep them home until they are symptom-free for 24 hours and fever and med-free for 24 hours. It's also important to prevent food poisoning, to manage safe food handling. This means washing our hands before and after cooking. It means being mindful of items that may be on kitchen surfaces and cleaning those surfaces after we cook. And also, in terms of preventing the spread in the home of stomach viruses, we can also clean and disinfect surfaces. Remember what I said, I do not need you to disinfect every day when children are not sick. But when there's a stomach virus going through the home, to prevent other children or adults from getting the virus, cleaning surfaces can really help. The most important take home is focus on hydration. Remember to wait that 20-minute rule before we offer any liquids. And when you're thinking about feeding your child after vomiting and diarrhea, remember that hydration is the priority. We can offer food to our child, keep it bland and not too exciting like spicy, sour, or fried, but we really want to focus more on hydration. I know it can be really stressful when your child is sick and you just want them to eat because you feel like eating will give them strength. But in the setting of illness, especially a stomach virus, that is the last thing on their mind. So focus on hydration and know the signs that you need to seek medical attention. Thank you for joining me today. If you found this video helpful, make sure you hit that subscribe button so you can stay up to date on all of my videos. Share this video on any of your social media channels and comment below with a heart or a thank you so that I know that you love this content. And thank you, and I'll see you next week.